Welcome back to another episode of Med School Radio. This is Simon. We're going to be looking at some more educational objectives from one of the Q banks. So let's go ahead and get started. Okay, what is schizoid or schizoid personality disorder? This consists of a persistent pattern of social detachment, preference, or solitary activities, and constricted range of effect in social interactions. One more time. Schizoid personality disorder consists of a persistent pattern of social detachment, preference for social activities, and constricted range of affect in social interactions. So remember that one. Okay, next one. Serotonin-releasing neurons in the central nervous system, or CNS, are located in the Raphe nuclei. So remember, the Raphe nuclei is where you would find these serotonin-releasing neurons. These neurons disseminate widely to synapses on numerous structures in the CNS. Antidepressants such as selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, and tricyclic antidepressants inhibit serotonin reuptake at these synapses. And remember where these are? In the Raphe nuclei. Okay, next one, we're talking about the heart. Leads 1 and AVL. Where do these correspond to? They correspond to the lateral limb leads on ECG. Therefore, ST elevation or Q waves in these leads are indicative of infarction involving the lateral aspect of the left ventricle, which is supplied by the left circumflex artery. Okay, so we're picking up these things. I'm just reading these educational objectives to put them more squarely in my brain. I recommend you do the same. What is tenofovir? Do you know tenofovir? Tenofovir is a nucleotide reverse transcriptase inhibitor that is a common component of HIV therapy. This drug is generally well tolerated, but may occasionally cause damage to the proximal tubule of the kidney, leading to acute kidney injury and or proximal tubule impairment. For example, phosphoruria, glucosuria, proteinuria, water retention. And biopsy typically reveals a normal glomerulus and renal interstitium, but damage is to the proximal tubule. Okay, so remember with tenofovir, which is a nucleotide reverse transcriptase inhibitor and part of HIV therapy, this can cause problems in the proximal tubule. Okay, next one. Okay, let's talk about carbonic anhydrase. Carbonic anhydrase is found in high concentrations in the proximal tubule and is responsible for catalyzing reactions necessary for NaHCO3 reabsorption, sodium bicarbonate. Acetazolamide is a diuretic that works by inhibiting carbonic anhydrase, which effectively blocks sodium bicarbonate and water reabsorption in the proximal tubules, resulting in urinary bicarbonate wasting. Carbonic anhydrase inhibitors are also used to relieve intraocular pressure in open angle and angle closure glaucoma. So that's carbonic anhydrase. It's morning here, having a cup of coffee. Okay, it's back to molecular biology, your favorite subject. Let's talk about tRNA and the 3' CCA tail. Is it 3'? The 3 with the apostrophe mark? The 3' CCA tail of transfer RNA serves as the amino acid binding site. Amino acyl tRNA synthetase is the enzyme responsible for loading the appropriate amino acid on the 3' terminal hydroxyl group in the CCA tail. Okay, let's talk about TTP, or thrombotic thrombocytopenic purpura. This is one of several primary thrombotic microangiopathies resulting in microangiopathic hemolytic anemia and thrombocytopenia, which are essential to the diagnosis. Plasma exchange therapy has prompted more rapid diagnosis and is life-saving. Okay, let's talk about Hasselbalch's triangle, the epigastric vessels. What are we talking about here? Of course, we're talking about hernias. The inferior epigastric vessels are useful as a landmark during laparoscopic hernia repair to classify the type of inguinal hernia. Indirect inguinal hernias protrude through the deep inguinal ring into the inguinal canal lateral to the inferior epigastric vessels. I'll say that one more time. So if we're talking about an indirect inguinal hernia, it protrudes through the deep inguinal ring into the inguinal canal lateral to the inferior epigastric vessels. In contrast, direct inguinal hernias protrude through Hasselbalch's triangle medial to the inferior epigastric vessels. Okay, so once again, so indirect inguinal hernias are lateral to the inferior epigastric vessels, whereas direct inguinal hernias are medial to the inferior epigastric vessels. Let's talk about Fragile X syndrome. What do you know about that? Think about that for a while. Fragile X syndrome is an X-linked disorder that presents with a long, narrow face, a prominent chin and forehead, and large testes. Patients often have developmental delay and neuropsychiatric findings that overlap with anxiety disorders, autism, and attention deficit hyperactivity disorder. That's Fragile X. Huntington disease. Is Huntington disease, is it autosomal dominant or autosomal recessive? That's right, it's autosomal dominant. Progressive neurodegenerative disorder characterized by chorea, psychiatric symptoms, and dementia. Psychiatric symptoms may occur early in the disease course and include irritability, anxiety, apathy, depression, and psychosis. Okay, what do you know about genomic imprinting? This refers to the phenomenon in which an offspring's genes are expressed in a parent-specific manner. Genomic imprinting is caused by DNA methylation